Welcome back, everyone. So we are now at our fireside chat. And as you may have noticed, we don't have a fire, but you know what we mean. So this is your idea. This is what you have in mind. And so it'll be informal conversation. I know that we have a couple of students who have worked with census data and are willing and eager to say a few words about what they've done. So let's see. So who do we have? Zoe, are you? You are here. Okay, so there's Zoe on the Zoom. So do you want to start and maybe introduce yourself and say a few words about what you've done?
Yeah, absolutely. So I'm Zoe. I'm a third-year PhD student in biostatistics. Thank you so much for your lovely talk earlier. I work with census data because the project I'm currently working on is looking at a sort of sampling design for air pollution monitor placement, and asking questions about where do those monitors actually physically get placed in cities, and how does that affect not only the estimates of air pollution throughout a city, but for who in the city those estimates are more accurate and for who those are less accurate. So I'm working with census data to get a picture of like socio-demographic and racial makeups of different neighborhoods. So looking at, for instance, percent of the population living below the poverty line in every census tract, and seeing if there's any association between that and the density of air pollution monitors near that census tract.
Great, thank you. Okay, hello. And Harvinit. Okay, please go ahead. And please introduce yourself first.
Hi, my name is Harvinit. I'm a PhD candidate in data science, and I'm actually in the same lab as Zoe. I work with Professor Rumi Churara, who is at GTH, and we are studying the question of how do we design surveys to better measure health disparities. So in particular, we are working on survey design methodologies to get more precise estimates of health disparities between social demographic groups. And we needed data sets to kind of test our methods. And so that's where US Census data comes in. And in particular, we use the microdata that you mentioned from American Community Surveys. And as we are working with this data sets, like one of the realizations that we have is just the how skewed the data is. As in once we get into measuring disparities across multiple marginalized groups and also studying intersectional identities between groups, the sample sizes become too few, and there's only a handful of states where we can actually do this. So as a takeaway, like it's just we need better survey. Like specialized surveys for measuring health disparities in order to close the gap.
Which ACS data set do you use?
So we use a 2018 sample from it's called PUMS or the micro.
So is it a 1-year sample?
Yes.
Okay. Have you ever used the 5-year sample?
No.
Okay, that's 5 consecutive years of the ACS squished into one. So sample sizes are much larger.
Yes. Yeah. We'll look into that. It's kind of. We are studying kind of like point in time kind of disparities, not
averages over time. Okay.
Thank you. And Yuan, please introduce yourself and then tell us what you do.
Hi, everybody. My name is Wen Zhao. I'm a fourth-year PhD candidate in EPI. I also work with Dr. Rumi Churara. And in my research, I actually have 2 research projects involving census data. The first one, we want to do a risk prediction of different health outcomes, including hospital admission, emergency department use. So we use census tract as a zip code level social determinants, including, for example, racial distribution for a certain zip code as a social determinants to in this prediction model. And another project is we're kind of measuring social vulnerability index across the US and some other countries. So specifically for the US context, we use the 5-year actually American Community Survey at county level to come up with this social vulnerability index for each county. I think several interesting findings. For the social vulnerability, we did identify that household income kind of has higher weight for determining certain vulnerability of certain counties. And for this risk prediction models, we kind of find that occupation distribution at zip code level has pretty high importance for our different health outcomes.
Great, thank you. All right, very good. So it's in your hand.
Okay, well, thank you for this illustration of the different types of problems you're working with. As I said during the talk and the Q&A, it's really important to understand the strengths and limitations of the data that you have available through our census data statistical products. If you're interested in the point in time, for example, and your research question is so narrowly, not so narrowly, but is so focused that you require an individual year, it's the best you can do is the ACS 1 year. And if that is insufficient, then it's insufficient. I mean, that's really the best that we can do. That doesn't mean all hope is lost. There may be other ways of looking at the information. So whatever your research question is, one might explore other data sets from the private sector, from universities. There are various, they call them like depositories, like ICPSR, and there are others that may have data sets that are available that look at that issue. And if there aren't, one needs to recognize the limitations of the research. So you can still do stuff, but your research is going to be limited by the fact that your sample size has ended up weakening now. So that's, I wish I had better news on that, but that's kind of like the state of nature for that. What I really like is that folks have globbed on to a specific, their own research question, and then actively gone out to find the data that can be used to address it. All too often, especially in data science, folks are told, oh, census has a lot of data. So you go explore the data and then find something that you might want to explore. Well, that's a great way of looking for anomalies in the data, as opposed to answering a research question. So be disciplined, find a research question you want to pose, and then go out and compile the information from different sources, be it Census Bureau or others, to address that issue.
Great. Anyone else? Any other questions? A great opportunity. So ask anybody on the Zoom. I'm sorry, what?
Looks like Zoe has a question.
Okay, Zoe.
Yeah, so I think sort of based on like what you were just saying about like the strengths and weaknesses of the census data, I was hoping you could describe something that I ran into to you and hear your thoughts and opinions and thoughts about directions that the Census Bureau might be going. Because I'm working with spatial data, I know that the census tracts are sort of designed to get a similar population size. Unfortunately, that means that they're dramatically different geographically sized. And I think it would be really great if there's access to data that came at sort of a similar, that each unit was a similar geographic size. And I wonder if you've talked to other people about trying to use the geographic nature of census data and their thoughts on this, and whether there's any thinking about going forward and doing sort of census-like data collection and dissemination that is at a similar geographic size as opposed to population size.
Oh, that's it. Okay, so I finally got your question. I thought you were talking about population size, but you're talking about area. Like
yeah.
Area. So you can look at density of population in similar sized geographies, right?
Yeah.
There may be ways to, with geographic tools, either from, have you heard of Esri, ESRI? They're the folks that do a lot of geographic work, but also from our geography division at the Census Bureau. There may be tools where you can actually draw your own geography on a map and then have the data imported or estimated on from Census Bureau sources. I don't know exactly. I don't know if we have some former data dissemination specialist, if that resonates and if you know of any product like that. If it isn't available from the Census Bureau, it may be available commercially through Esri or some other source like that.
Tableau.
Huh? Tableau
as well.
It could be available through Tableau. So take a look at those guys. Alternatively, one, and it's clunky, admittedly, one can take census tract or block group data, and you can create your own amalgamation and basically go through the laborious task putting together the census data for those units and do it that way. It is a challenge, I confess, but there may be data tools already out there that can help with that. In particular, there's something called I can't recall whether I already discussed this, the community resilience estimates.
Yeah.
With you guys? No? Okay, if you Google community resilience estimates, it is a joint project between FEMA, NOAA, and the Census Bureau to superimpose Census Bureau data, including risk factors associated with the resilience of a local community to respond to a natural disaster. Which means if you take a census tract that has a high percentage of seniors, say, that tract will be more at risk in terms of being able to respond to a natural disaster, a flood or a tornado, than a neighboring census tract that has a low percentage of seniors. The same is true with different types of natural disasters with regard to broadband access or the percentage of people who are disabled there or a percentage of people in group quarters, those types of things. We have created a list of 10 different risk factors and created thresholds as to whether those were exceeded, whether there's X percent of the population or more relies on public transportation, or doesn't have broadband, or is disabled, or has a percentage of seniors, and then counted the number of risk factors associated with those thresholds, and then plotted them on the map. I could imagine you being able to superimpose some of your data from that you were looking at in terms of the air monitor, quality monitors, to take a look at the results and do some analyses in that fashion. It's already created. It's a resource. And in fact, if you think about it, the different risk factors that are built into that right now are highly related to the social determinants of wealth and health and things of that sort, which is a common framework for assessing society and societal needs. So take a look at that. There is also an enhancement of the community resilience estimates called Community Resilience Estimates for Equity that adds some additional data points and possibly thresholds to look for disparities.
Thank you.
Other questions, comments in the room, on the Zoom?
Director Santos, there was a question asked during break about your career path, how you started and how to get to where you are today.
Okay, do folks want to talk about that? Okay. I've had a pretty long and windy road in my career. As I said, I think I said to you guys, I was a pretty shy student. And in high school, I really didn't have any friends, not too many anyway. And I didn't, even though I really loved math and I did really well in math, I was too shy to go to my high school counselor. So somehow I ended up graduating high school without ever having to visit a high school counselor. Because I thought that you could graduate in May, you could look at colleges in June, you could apply to them in July, and then you could attend in September. See, I got a laugh out of you. That's good. So obviously it doesn't work that way. And so I ended up going to community college. I went to San Antonio Community College for a semester. And because I had such a passion for math, that I took calculus. It was before, you could take calculus in high school. And the professor there, the teacher, saw my passion and said, you need to get over to a university and get your bachelor's degree in mathematics. And so I was able to finagle away, like my aunt, my Thea, knew someone at a local liberal arts university in San Antonio who was a staff member on the dean's office. And so I don't know how she did it, but she got me an appointment with the dean, and we sat down. And I went in my best. I was like an aspiring hippie type, Latino, Chicano, aspiring hippie. So I went in with my long hair, the best T-shirt I had, and my cutoffs and flip-flops. And we had this nice conversation for an hour, just about life and about where we wanted to go and this and that. And at the end of that hour, the dean said, if you apply, you'll be admitted. And so that's how I transitioned from community college into university. I ended up taking almost every math course that was there at Trinity University in San Antonio. I was one of the few, I hate to say it, but I was one of the few local community Latinos that they brought in, because it was mostly a rich white university at the time. And I took all these math courses. I graduated, I was graduating with, a respectable, 3.7 or something like that. I wasn't an A student. And I go to my professor, math major professor, and I said, I want to be a math professor. And literally the professor told me, son, you just don't have it. So I said, what? And because he knew, I'm not trying to make excuses, but he knew that I was first generation community college. And he knew that at that time, this was like back in the mid 70s, that at that time, no one respected a math PhD. So the only job you could really get was a math professor, and you had to be the best of the best of the best of the best to ever think you could be a math professor. And because he knew and wanted all of his students to be successful, he said, go into statistics. You'll always have a job, you'll do fine. So I said, fine. I applied to university, to different universities. By the way, I was an unconventional college student. I got married to my wife, Fidela, over there. We're now in our 49th year, going on 50. And so I would just, drive in to class and then drive back, to my life type of thing. And we wanted to get away as far from San Antonio because I was born and raised there, never been north of Dallas. And lo and behold, after all these different rejections from grad school, University of Michigan, Department of Statistics accepted me on a fellowship. I was basically one of the last beneficiaries of affirmative action. So they gave me a fellowship to go to the University of Michigan. I said, amazing. So we went off to University of Michigan, and I happened to then get associated with a group of Latino graduate students who hung together, and we would help out all the undergrad Latino students that would come, because most of them They would like come from, there was a program for migrant workers. And so if you lived in the Rio Grande Valley in Texas, they would accept you with a scholarship as an undergrad in Michigan. But you were going all the way to Michigan. They wouldn't last until Thanksgiving. They'd stay in class till Thanksgiving, go home for Thanksgiving and never come. So we made it our mission to work with those undergrad students, to get them to stay on board, to find ways to get them loans. And we navigated everything, found out all who to talk to in the university ecosystem and how to get monies for them, how to support them, etc. And that collection ended up being really empowering in me in two ways. One is it really expanded my appreciation and love for being who I am, a Latino, a Mexican-American. And secondly, it ended up getting me associated with a researcher at the Institute for Social Research, Survey Research Center there, who was doing the first ever national survey of people of Mexican descent. We called it the National Chicano Study. And he tried to get as many Latino grad students together to use that as a vehicle to teach them research methods. And he found out that there was this punky kid from San Antonio in the Department of Statistics learning math. And he called me into his office and he said, "What do you want to do?" And I said, "I want to be a math statistical professor, right? I can't be a math professor. I can be a math stat professor," because I was learning mathematical statistics. And he said, no. You want to give back to your community. You need to learn survey research and sampling. And I want you to design my national Chicano study. And so he took me down to the sampling department in the Survey Research Center, introduced me to one of the founders of the Institute for Social Research. It's a renowned research center, and told Leslie Kish, who's the godfather of survey sampling, "This is the kid I want to design my sample." And Leslie, of course, everybody kept telling me no, not this kid. You know, he's from the statistics department. He doesn't know anything about sampling, but we'll teach him and he'll be a part of the group that designs it. And so I ended up designing the National Chicano Study, the sample. And I did it with Bob Groves, who is now a provost at George Washington University, a renowned survey methodologist. And he is a former director of the Bureau of the Census. So he was director of the Bureau of Census for the 2010 census. And so it's a small world, actually. So I learned survey sampling and then went off to Temple University at the Institute for Survey Research. And I was designing samples there. It was the little mouse that roared. It was a small research center, but we competed with all the big boys types of thing, with WestStat and Research Triangle Institute, RTI, and NORC, and all these huge firms. And we would beat them because of our price and our innovation and stuff. And I finally decided, you know what? I want to understand the consequences of my design. And so I ended up becoming a project director. And that gave me the experience to then get recruited back to Michigan, back to the Institute for Social Research, Survey Research Center, to be their first ever director of survey operations. Because by that time, I was heavily involved in sampling, sample design, sampling statistician. I did survey analysis. I trained interviewers. I was involved in survey processing. I wrote proposals. I did it all. And so they used that experience then. I used that to become a leader there. So I went from being a aspiring math professor, an opportunity came up and I took a little turn and I became a mathematical statistician. And then I took a little turn and I became a sampling statistician in survey operations. And I took a little turn, I became a project director. And then I took a little turn and became a director, a manager, a leader. And each time I would just build upon my experience. So I didn't take this direct route. I just, every time opportunities came up, even if it wasn't exactly in the straight line to where I wanted to go, I would take them. and that would lead to other opportunities. And I would take them. But that was my long and winding road. I went from Michigan then to NORC to be a vice president for statistics and methodology, to Urban Institute, to becoming a co-owner of a research center in Austin, Texas, and then back to the Urban Institute for 20 years. Worked on all kinds. I was a statistician. And the one thing that Leslie Kish told me, the founder of survey sampling at SRC, he said, be a sampling statistician and you get to work in everybody's backyard. And if you think about all the things that I've said today, it's a result of me being the statistician who worked on an education project, who worked on a hunger project, who worked on employment stuff, who did research on reincarceration among prisoners, who did a high school study of seniors, who did this, who did that. I've worked on all these different policy areas. So I know the value of census data because we use that a lot in our design. But also I learned a lot. You absorb a lot and you can take lessons learned in one area and apply them in the other. And that allowed me to become more useful to people. And so I climbed the ranks and became vice president at Urban Institute. I stayed connected. This is really important. Stayed connected in professional associations. Because I was often, because of the place I was in as a sampling statistician at Temple, as the first ever survey operations director at Michigan, at NORC as a VP, I was often the sole person in my organization at that level. I didn't have colleagues. And so my connection to peers was through professional associations. And I became active. I would organize sessions for the joint statistical meetings. I would get on committees. I would volunteer. And pretty soon they asked me to run for office in the section. They asked me to run for office in a chapter. I ended up becoming ultimately president of the American Statistical Association. I was president of the American Association for Public Opinion Research. It was because I stayed connected. And two things happen. You learn new leadership skills in a way that you otherwise wouldn't by sticking just with your organization, like just with your home organization. You get those opportunities. Plus, you interact with other folks. So all of the jobs that I got, most of them were somebody calling me up and saying, hey, there's an opening over here. We want you to come apply to it. As opposed to, saying, oh, I'm in the job market. Where do I go next? All of it was like recommendations and inviting to apply. So that is really, really valuable. So I encourage you to think broadly. If you want to, it's your life. Stick to the straight line to where you want to be, if that's what you want. But recognize that there are great career opportunities if you veer just a little bit, and that can blossom up more branches that you can choose from. Go there and go there, and you'll climb your way very close to where you originally wanted to be, or somewhere even better. That's my story.
Thank you.
Other questions?
Sort of a broad one so like, since we are now in kind of a post-truth world, or like the world of like fake news and so on, so how do you see like the role of a statistician changing, or does it have to change in this sort of world where like the facts sort of do not matter for sometimes? So kind of, if you can comment on.
Did you say facts do not matter?
As in for some people.
Yeah, different alternative facts, disinformation. Yeah. It is a challenge. But what I say to all of that is that it gets back to this: you bring your whole self to the table. You use your values of scientific integrity, of objectivity, and you tell it like it is. The world needs to acknowledge what you've done or reject it if they want, if they think that it's not of value to them. And that's whatever happens, happens. But you need to be true to yourself in terms of following that. There is a challenge in statistics because statistics is a generic field. And biostatistics is much more refined to a certain area and set of industries. And then there's data science, which is sort of taking over type of thing. But statistics, I think, is it's both a threat and an opportunity. The threat is that, there aren't too many jobs just for a generic statistician. And that may be true, but there are more opportunities for being a statistician in agriculture, being a statistician in education, being a statistician in political science or polling, being a statistician in this or that. And you can take advantage of that. And you can learn from that and grow from that profession. Other questions? This is a fireside chat. Ask me anything. Yes.
Sorry, actually I was on Zoom on both sections. So
well, nice to meet you.
Yeah. So I know you might have said this question earlier, but I just want to ask, what would you say or advise to new? Like you mentioned, there are more leeway or more branches with statistics, being a statistician and there are more, how would I say, unique or narrower way with biostatistics or something. So what would you advise for young biostatisticians on how to, because most of the jobs now are like, they require you to have some kind of years of statistical knowledge or have some kind of, so what about those that new fresh graduates that doesn't have that years of experience and also going in a field that mostly recognizes mostly statistician and in general, not like in section like just a biostatistics or something. So how would you advise us to grow or advance?
And sort of get a career opportunity? Is that where you're going? Yeah. I would absolutely advise you to get a membership in an associate professional association. Because if you're a student and you do it now, one, it's really inexpensive. But secondly, you can begin the process of networking with others. And that will lead to opportunities. So make sure that you do that. And then secondly, do not judge for yourself whether you're qualified for a job. Let somebody else decide that. So if you're anywhere remotely interested in something, even if you're a biostatistician and it's a generic statistician job, apply for it and tell them why you are qualified for that position and let them decide. So you shouldn't exclude. Don't do your own filter. Let somebody else do your filter. Cast your net widely, and that will absolutely help you. If you happen to be, and not everyone is, if you happen to be a U.S. citizen or soon becoming one, there are federal government jobs. We absolutely love statisticians. So there's many opportunities, not only at the Census Bureau, but in all the other federal statistical agencies and even in departments all over the federal system, even at the state and local government. They're always looking. Private industry loves statisticians regardless of whether you're a citizen. Like I always go to the Googles and Facebooks. I mean, those are the dream jobs for some statisticians and survey methodologists. So you have sort of the Silicon Valley collection of entrepreneurial organizations, as well as sort of your down home production areas like, GM, like the auto companies and the manufacturing plants, things of that sort. Statistical process control is alive, so there's many opportunities for statisticians and biostatisticians. And I guess I would recommend that biostatisticians do not think of themselves as biostatisticians, but as statisticians with some extra techniques or extra perspectives. And if you think of it that way, then you have even more opportunities to.
Great. Any last questions before we wrap up?
Yes.
I guess the last question will be like for someone already finding a job, like most of my peers, if they get out of a master's degree, they will be in a junior statistician role. So what kind of skill set they can learn to through their job or outside of their work to like refine them and help them to get to a higher place or to advance their knowledge in stats as a junior role?
There's a couple of different ways. The first of which I talked at length about, which is you need to bring your whole self and you need to give your ideas and perspectives freely. Ask questions. Ask well, why do you need to know this question? Ask, what is the research question I advised you? Just get people to focus in so that they understand that you're not the regular statistician type of thing. You're not the type of person that simply does what they ask for. Because if you do that, you're going to be spending your life doing power calculations and running some analyses with very little reward. You need to show them that you're capable of critical thinking, and that through that critical thinking, you can actually improve their project. And you're doing that in a way that gives them the credit because you're making them think stuff. They get, and the way I did it, which I don't necessarily recommend is the way you do it because it's a different world now. But from my perspective, I don't have a PhD. I have a master's. I could care less about, I hate to say it, don't think different of me. I could care less about journal articles. I didn't want to be a journal. I didn't want to write journals. That took way too much time for me. I wanted to be a doer. And so I lived my career as being one where I tried to make the PI rich and famous by giving them the best ideas and making them think about stuff, etc. Remember I said there's two things that I love in life, statistics and helping people. So I just went at the helping people aspect. Yeah, when my time came as I grew and I was able to direct projects, to write, I think I've only done a couple of journal articles, but do a lot of reports and analytic things and things of that sort. But principally, I was there to help other people become even better. And if you do that, people are going to want to grab you and take you. And so, it's not for everyone. Some people like to, let me show you what I can do on my own as a leader, and you should do that if that's where you come from. But I guess that would be my advice.